We're back.
We are back. Yeah, you're back. Okay, great. So the Instagram feed remains the same, but unfortunately for
YouTube, it kicked everyone off.
it kicked everybody off.
Oh, sorry. We love our YouTubers.
Yeah, we do love our YouTubers.
Our tubers.
Okay,
Yeah.
Instagram.
Yeah.
I will strongly recommend, for the sake of simplicity, that if your question wasn't answered on YouTube and Facebook, they should re-ask it.
Sure. Okay.
This is the thing with a live show. You know, there's a little bit of chaos here.
Yeah.
Apologies. Hi, Dr. V. I appreciate you very much. When is the best time to do LIT treatment, and how far before a FET? Thank you.
At least a couple of months. So minimum 1 to 2 months before, because you want to recheck your levels and make sure that they're okay. And we are doing LIT therapy now.
Is getting a massage safe during an FET prep if you have a naturally high NK cells?
Wow. Just when I thought I couldn't be stumped, I have no idea. I've never seen anything relating massage to NK activity. I will look that one up. I don't know if the iPad's alive. I wonder if the iPad's alive. Let's have a look.
I'm going to ask you something while you're going.
Yeah.
All right.
Oh, the iPad's alive.
Here we go.
All right. Yeah, go ahead.
All right. The question is,
Yeah.
would you suggest any US-based laboratories to provide microbiome tests similar to Fertility?
No, because I don't know of any that do it. So, yeah. No.
There you go.
Not yet. I wish there was one, but I genuinely don't know.
My lab still doesn't do it yet.
Yeah, I don't know of any.
Yeah.
Okay, massage
And NK cells.
and NK cell. No cells. NK cells.
Everybody said they could see your code on the iPad. Just joking.
Natural killer cells and lymphocytes increase in women with breast cancer following massage therapy. Who even studies this? Like, who came up with this? The effects of massage therapy alone and in combination with other complementary therapies on immune system measures and quality of life and HIV. Wow. It's all breast cancer related. Like, there's a 1,000 studies on breast cancer. Like, this is crazy. There's a whole bunch of stuff on breast cancer. And, I got to study this more because I've never even heard of this before. But it would appear that there is an impact. I got to see if it's good or bad. It looks like it increases your NK activity overall, but never heard of this before. So, and certainly nothing's showing up for fertility. Yeah. Wow. It's saying, like, even for HIV that you increase your immune function when you get a massage. I had no idea.
Add that to the list of the cold.
I've had one massage in my entire life. Have you? Two. I've had 2 massages my whole life. Have you?
So, this is actually a story. So one day, I go to China.
Okay.
True story.
Just because you woke up one morning and
Just
said,
one day-
I'm going to China?
I'm in China.
Okay.
And I'm in a very rural part of China. I'm not in Beijing. I'm not in anything major. I'm in a very small rural city.
This is for business.
Yeah. Called Chongqing.
Chongqing. Okay.
And I meet with one of my clients, and he tells me, would you like to get a Chinese massage? And I said to myself, no. I'm not comfortable with the idea,
Because you don't know what to expect.
I don't know what's going on.
This could be more
I'm not willing to take the risk.
Saigon massage.
Right. I don't know this guy. I don't know what his idea of a good time is. I'm not in.
Okay, yeah.
So anyways, he's like, come on. It's part of the culture. We have very famous massages here in China. You have to come. I said, fine.
Oh.
I go against my judgment and
All
say,
right.
okay, let me be quote unquote multicultural.
Peer pressure. Wow.
Yeah.
You succumb to the
Major
peer pressure. Wow. Okay.
He said, well, what kind of massage do you want? I'm like, I want the simplest non-massage possible. He said, well, they got a foot massage. I'm like, I'll take that.
Okay.
That's got to be safe.
Yeah.
So I go in,
Yeah.
sit down, and the lady's like, take off your pants. And right away, I said, I'm just getting my foot. I said, I'm just getting my foot here. I'll take off my socks, but what's the deal with the pants? She's like, well, we go higher than the foot. I'm like, so it's like a leg massage? And English here at this point is minimal. So
Right.
she's just nodding her head. But I can tell she has no idea what I'm saying.
Okay.
So, okay, fine. I take off my pants. And I'm laying down. She's massaging my feet. And then it starts to hurt.
Is this PG?
Yeah.
Okay.
Yeah, well,
I
you should have left it as a suspense.
I gotta warn the
You should have left it as a
audience.
suspense.
Yeah.
So then she starts pulling out my toes or whatever she's doing.
Yeah. And it's hurting.
And it's borderline pain.
Yeah.
So the other guy next to me isn't complaining.
Yeah.
So I said, well, I can't complain. You know what I mean? This is just that man thing going on. But there's no joy at this point.
Yeah.
I feel like I'm suffering,
Yeah.
but I want to say stop. Like, I want to say that's enough.
Yeah.
And he's just quiet.
He's happy.
I don't know, but
Okay.
he's quiet. So I'm like, well, if he's quiet, I'm quiet. So I feel like I'm getting beat up, right? Non-stop bruises and punches to the leg is basically
Yeah.
what it feels like. And like she starts going up to the thigh area now.
Yeah.
So I said, whoa. Where are we going? Where are we going here? And she said, we're just doing the legs.
Yeah.
I'm like, foot. Go down, foot. And she's like, legs. And for those that can't see me, I'm doing this motion right here.
He's doing this.
She's like,
Yeah.
just legs. I'm like, all right, legs. So sure enough, she goes through it. Ends up just being legs.
Yeah.
But I walk out of there freaked out because she
Agonized.
came up so high. I got so nervous. And the other guy the whole time's quiet. So I'm like, well, I'm sure he would have said stop or...
Right.
But at the same time, I don't know the guy. So
Right.
I don't know
Right.
what's supposed to be happening.
Right.
Moral of the story, that was the first massage I got and the last massage I got. Because the amount of how tense I was and so freaked out about what's going to happen next, I couldn't mentally wrap my mind around what the hell's going on.
Yeah.
And that was it.
I got reputable massages from
This is
reputable
a famous massage place in Chongqing, man.
Chongqing
Chongqing massage.
massage house.
So,
Okay then.
there you go. That's my
That's a
story
good
of the day.
story.
Story of the day.
We've got E. Kelly XO. Is there a delivery position that reduces the need for C-section? Well, supposedly, if you are squatting, it does improve your ability to deliver and reduces tears. Every obstetrician out there is going to freak out by me saying that. However, there actually is evidence for that. And this is something the midwives do better than we do. So yeah, delivery position can help you. However, I don't know that it actually reduces cesarean section rate. It just helps you push the baby out. So I don't believe there's any position that helps with actually reducing cesarean section. That's a good story, man.
Just trying to share something, mix it up a little bit.
What's next?
There's a lot on Instagram, so we'll give these Instagrammers a little bit of time here.
Yeah, give him some love.
So, hi, Dr. Victor. I have PCOS. I'm taking Ovasitol.
Yeah.
If I end up pregnant, should I continue taking it or stop?
No, continue.
Can you have too much lactobacillus? What CFU vaginal probiotics do you recommend?
Yeah, the CFU thing I don't really follow that much. We basically just try and flood people with the probiotics. So no, you can't have too much. We don't focus on the number because each of the products is different and they all say this one has 15 billion and that one has 10 trillion or whatever. Like you can't stick to that number. It doesn't mean very much.
How long does it take to hear from your office if there's a red flag or an anatomy scan, or do we wait until the next appointment to tell the patient?
Typically, if it's important enough that follow-up is needed urgently, we call you within a few days of the time that we receive the result. And the only reason it might be a few days is if it's a weekend or I need to review it or I have questions about what I see before I want to talk to you about it. So usually very quickly, if there's something wrong, we will contact you.
How can my husband improve his sperm count? He has lost a lot of weight, very healthy diet, stopped smoking, but his sperm count doesn't seem to improve.
Ejaculate every day or every 2 days. No smoking, no drinking, no drugs, including marijuana. No vaping. So none of that stuff. And that includes shisha, hookah, all that stuff. Make sure you're taking fertility vitamins and keep your testicles cold. We have a great video on YouTube, which, by the way, for some reason is frozen. It is not. It rocketed to 97,000 and it has not moved for like 2 months or 3 months now. Like, it has not budged. And we shot up to like almost 100,000 and it just froze. I don't know if they like think it's bad because it's.
They paused it on us.
I wonder if they freaked out because it says sperm on it, right? Like maybe they panic when it's.
They might.
But it did great up until then, and then maybe we need to contact someone at YouTube.
Question.
Yeah.
Hand pink waving.
Okay.
I had an IUI Friday and tested today because I was curious, and it was a negative pregnancy test. Was it too early to test if my IUI was just Friday with the trigger shot Thursday?
Yeah, it's way too early. There is no test that would detect it that early, not even a blood test. Stop testing that early. Wait your 2 weeks.
Hi, Dr. VT. Great show. I'm 31, spouse 28. He has high DNA frag. We did IVF, got 5 blasts, didn't do PGT, miscarried at 8-9 weeks with first transfer. Should do PGT before the next transfer?
No, never do PGT after you've frozen your embryos. There's a recent study that shows that it's detrimental, so do not do that. Actually, that was another thing they presented at ASRM. There is a huge decrease in success if you thaw embryos and rebiopsy them. So don't do that. No, what we would recommend is reduce your partner's sperm DNA fragmentation, because men with high sperm DNA fragmentation lead to a drastically increased risk of miscarriage. And that's been shown in many studies. The best one I read showed that it was 1,183% higher. It's like staggering. So we don't do IVF with sperm from guys that have high DNA frag. We either use Zymot to reduce it, or we get them to do the double ejaculation 3 hours apart. And when you use the second sample, it's got 80% less DNA frag. Plus, no smoking, no drinking, no drugs, lots of vitamins, all that stuff.
Hi, Dr. V. Wondering what process you would recommend for an FET for someone with adenomyosis. Doctor said adenomyosis is on one side of the uterus and everything else looks fine.
Well, you can't have adenomyosis on one side of the uterus. You can have adenomyoma on one side of the uterus, but not adenomyosis. So I don't understand what that means. But we use an endo protocol. So our standard endo protocol for our adeno patients. Now, certainly if you have an adenomyoma, you need to consider removing it, because those suckers cause a huge amount of inflammation. But if it's adenomyosis, we use our endo protocol, which I outlined earlier in the show, and we will have a video on shortly.
No.
Oh, okay. Cool.
Yeah. Would you suggest... Oh, we did that. Second egg retrieval, 14 eggs, none fertilized, not even one egg. 41 years old, AMH 3.6.
Wow.
Doctor says to go to egg donor. No recommended third egg retrieval.
I would need your full history. But there are always ways to look at why you're not fertilizing. So, you got to check the sperm. You got to check your partner's history. You got to look at your egg quality. I need to know if they did oocyte activation. I would want to see what the DNA fragmentation was like. I would want to know how much of a dose they used for you. We wouldn't give up. If you can make that many eggs, there's got to be a very significant reason why you're not getting any fertilization. That's something I would want to take a close look at. So contact us, info@drvictory.com, and we will get back to you.
All suspicious right away.
Yeah, there's something wrong there.
Something's wrong.
Yeah, and that could be lab problem, right? Like, different centers have different success rates with ICSI, and that can be critical. So it very much depends on where you're getting your ICSI done.
A question that seems to be asked on all platforms that it has shown up now on my site, but I see it multiple times.
Yeah.
Is it safe to use a Fitbit Watch in early pregnancy?
I'm not aware of anything that says there's a problem with a Fitbit watch. Yeah, it shouldn't be a problem.
With PCOS, can you try for twins your first IVF?
Can you? Yes. Should you? Never. Nobody should try for twins. It's high risk for babies. It's high risk for mom. It's high risk for your relationship. It's an 80% divorce rate. So can you? Yes. Should you? No.
If vitamin D is slightly low, should I delay embryo transfer until it is in the normal range?
Yes.
When testing vitamin D...
I love the easy ones. Those are good for me.
Yeah.
It's like a workout and you need like a little break.
That's the break.
That's my break. Yeah.
Catch your breath.
Yeah.
My doctor said... Oh, wait. When testing vitamin D, should I...
You did that one.
Okay. My doctor suggests I ovulate through Ganirelix.
Yeah.
And I lost many eggs. What causes early ovulation and how can it be prevented for my next cycle?
If you didn't inject it properly, if the Ganirelix was bad, if they started it too late, or if your estrogen levels are too high. So there's lots of different reasons for it. And sometimes it just doesn't work.
My doctor suspects I ovulated through... Oh, sorry. Did that. How much of a role does prenatal vitamins compliance impact spina bifida risk?
Oh, substantial. So there's evidence from a long time ago that folic acid not being sufficient was the main risk factor for spina bifida. So that's when they started putting basically, folic acid into everything. So it's really important that you get folic acid. The vitamin content is critical.
Where are you located at, and do you take new patients in their 40s?
We take patients at every age. And we are located in Windsor, but because of the fact that fertility is virtual now, in a large part, probably about 20 to 30% of our practice is virtual fertility. And then our patients just come in here. So we have loads of Americans, Europeans, Australians who actually come to us for our fertility treatments because we do a really good job. And we have many Americans who have come to us who've been successful in their own clinics, including some huge juggernaut instrumental clinics. Told them they needed donor egg and we got them pregnant on first try. So don't hesitate, come see us and we'll help you out.
Hi, Dr. Victory. Does Clomid FET Cycles have the same success rate as Letrozole FET Cycles?
Oh, that's a great question. I'm not aware of anyone that's using Clomid for FET cycles because it actually drives your estrogen levels up and thins your lining. Clomid is known to thin your lining, so I don't know of anyone that's doing that, nor would it make much sense. But I'd have to look into it. I've never seen anyone do that before.
Is there a standard time to wean off of prednisone once pregnant? Example, 12 weeks, or does it vary by person?
Yeah, it varies by person and condition, but typically we'll aim for 12 weeks. Yeah.
My doctor is recommending LCN during stimulation, but should I be starting it ahead of time, 2 months out from egg retrieval cycle, so my body can get used to it and reduce inflammation?
LCN? I think they mean LDN, low dose naltrexone.
They wrote LCN, but that can very easily be.
I'm not familiar with LCN, but low dose LDN, which is low dose naltrexone. I'm not a believer yet, so I don't have a lot of info on that. There is evidence that it's good. I'm just not convinced by it yet, so we don't use it. Yeah.
Why does T think he's a doctor? Seems to be a question some people are asking.
T has listened to how many of these have we done? Probably 300 of these.
Sure.
right?
Absolutely.
We've probably done about
There's a lot.
250, 300. So he's learned. I mean, is he a medically licensed physician? No, but is he allowed to have an educated opinion? Of course he is. Yeah. Doctor, I have questions for you. I take IUD and I don't beast feed. I think they meant breastfeed, but I still have some milk. Is that okay? Yeah, it's fine. It's normal.
So one day I go to China. T, your stories are the best.
T, for those of you that have not heard his stories, is a legend at telling stories. He's like one of the best storytellers ever. I am always in stitches laughing my head off when I listen to his stories. He's absolutely captivating to listen to. We should do story time with T. You would be really good. Yeah.
A1C6.
Okay.
Should I take metformin before an FET?
Probably. I mean, I would need to know more about your history and how high your insulin is and how high your sugars are, but certainly worthy of consideration. Yep.
Hi from Alberta.
Oh, hey. I love Alberta. We're trying to do something there.
Dr. V.
A little something.
Oh, something.
Yeah.
We used an egg donor after 4 failed retrievals.
Okay.
Critical question to ask you.
Yeah.
Our doctor in prep for FET. Oh, critical questions to ask our doctor in prep for an FET.
Okay.
They're asking you, what are the questions they should ask their doctor?
Oh, wow. Protocol, vitamins, what's the embryo quality? What protocol do they use? When do they transfer? Do they monitor progesterone levels? I mean, there's a million questions to ask.
How long should metformin be taken prior to egg retrieval, and can it be continued in pregnancy?
Well, it takes a while for your stomach to get used to it, so I would say months if possible. And yes, you can continue it in pregnancy. You probably should.
What is your opinion on vaccines, flu, and COVID during pregnancy?
Flu is mandatory. Women that get the flu during pregnancy have a substantial risk of death. So you have to get the flu vaccine when you're pregnant. It's really important. COVID vaccine, I've become a total non-believer in doing the COVID vaccine. I was all for it, and I support the initial outlay of COVID vaccines because people were dying. The initial strains were very dangerous, and it was very harmful. And we know that, we saved loads and loads of lives by giving people the vaccine. So it was good at keeping you out of the hospital, which was the main thing behind it. It didn't prevent COVID infection, but it prevented the severity of the COVID infections. And that was critical for us back then. But since the new strains don't kill anybody, and the vaccines are definitely aggressive vaccines, there's absolutely zero indication to be getting vaccinated against COVID for the majority of people who are TTC. Yes, there are exceptions. I'm not blanket statement, this for everybody, but do most people need a COVID vaccine? No, most people do not need a COVID vaccine. So I'm opposed to COVID vaccines for everybody because I think that's silly.
Is ZIKA still something to be concerned about?
Yes. So go on the World Health Organization or the CDC website, and they've got these lovely maps which will show you where ZIKA is active, and don't go there if you're pregnant. Or TTC within 6 months of the time you have that.
Huh. Funny comment by a guy named Paul. T, why did you go to China for business? Did you secretly just go for the massage?
Good night, Soraya. Thank you for watching. I know it's so tiring for you. Thanks for watching.
Hi, Dr. V. I did an egg retrieval with you yesterday.
Excellent.
Resulted in 17 eggs, but only 1 fertilized. 8 are still being cultured. Any chance we can see more fertilized this week? Maybe egg quality issue?
We will have to see how it goes. And yes, there's always the potential that more of them might fertilize. So we'll see what the culture shows. And yes, if we're getting, so our fertilization rates are sky high. So if we're not fertilizing, there's something wrong with the eggs or the sperm.
Dr. Victory, does Clomid FET cycle have the same success rate as a letrozole FET cycle?
We asked that.
Does adding PICSI
Pixie
when doing IVF help to improve the results if my partner has a high DNA frag?
No, but there are really easy ways to reduce DNA frag. Pixie's useless. It's been proven to be useless, so don't bother. There's no value to doing Pixie.
You got Pixie, you got ICSI, you got a lot of
Yeah.
E's.
Yeah.
What is your success rate with patients in their mid-40s with IUI?
What is my success rate? Oh, God, that depends on 1,000 different factors. Are we using your sperm? Are we using donor sperm? Are we using your eggs? Are we using donor eggs? How strong are your ovaries? I mean, we have very, very high success rates for our mid-40s patients, but keep in mind that the average in North America is between 8 to 11%. So very high is just better than 8 to 11%. Nobody's going to get you a sky-high success rate in that age group. Over 90% of your embryos are going to be genetically not normal. You need to produce a ton of embryos just for us to find some that are good. So, there's challenges for sure. What is my favorite dessert to receive from patients? Brownies. I love brownies are my favorite dessert. No marijuana, for God's sakes. I don't do drugs. But brownies, walnuts, it's got to have walnuts or it's not a brownie. That's my favorite.
Walnuts, that's a good one, actually.
You got to have walnuts in the
Yeah, I
brownie.
agree.
9 o'clock, almost, 1 minute.
All right. How much of a role, we did that. There's a lot of questions coming up. Is folate or folic acid better? Or does it matter?
Folate and folic acid are the same thing. Folate and folinic acid are different, and folinic acid is probably better if you listen to the naturopaths.
Would you get 8 frozen eggs or 6 fresh eggs from a donor bank?
Huh? Would I get 8 frozen eggs or 6 fresh eggs? 6 fresh eggs will kill 8 frozen. Is that the question?
From a donor bank, yeah.
But you can't get fresh eggs from a donor bank. It's always frozen. I don't understand that question. That's confusing. Is there a way to unblock tubes and avoid going through IVF? Yes. An interventional radiologist can literally bust through the tubes using fluoroscopy, but it only has about a 40% chance of staying open.
I didn't know that.
I wouldn't have expected you to know
that one I didn't know.
Yeah.
My RE is suggesting LDN at STIM, but should be taking it earlier so my body can reduce inflammation.
That was the question she asked before.
Okay.
Same person. Probably.
Okay.
Yeah, low-dose naltrexone, lots of people believe in it. I'm still not a believer, but there is evidence for it.
What are the side effects of intralipids? Would adding it ever be detrimental to an FET?
Not that I am aware of, and aside from reacting to it, we never see any side effects.
2 questions from different people, but same kind of question. What is the success rate of IUI, and what is the IVF success rate?
Success rate of all of these things depend on you. So there's no way to blanket answer this, right? But I can tell you that in general, overall kind of overarching success rates in a younger than age 35 category, IUI with pills 10 to 15%, with shots 20 to 25. That's based on research. IVF, highly dependent on where you go, who you are, what the protocols are, how many eggs you have, and so on. We are getting 82.3% with one genetically normal embryo. So very high success rates.
I'm in an Airbnb in Windsor.
Okay.
Waiting to start my duo stim with you.
Okay.
But my cycle is 1 week late for the first time ever. What do I do now?
Call the office and we'll help you out. Don't worry. That's easy to fix.
Do you interpret the results from Fertility as well as advice on treatment?
Of course. Every time.
If eggs have fertilized but don't make it past 3 days, is that a sperm issue?
Yes, most likely. It is thought to be a sperm issue. Yeah.
Is
Gotta
there?
wind it down. It's
Yeah. Okay. You want one?
I got a hungry kitty.
Let me figure it out. Oh, you know what? Speaking of kitty, how was your kitty?
My kitty is beautiful. I love my kitty. He's super cute. Wendy's away, so I got lots of purrs last night, which was fun. For those of you that didn't get your questions answered, and I'll just throw this out there, Tarek and I are considering doing a kind of guarantee to answer your questions session, but we would kind of have to charge for it because it would be separate from this one. So we would promise that we'd answer your question, have a small group of people, like what we say, like 30, 50 people each time. And we would give you enough time to answer like, 2 or 3 questions per person, and go through it in detail with you and explain. So if people are interested in that, can you let us know if that's something you would like? We will do it if people think it's a good idea. And it would just be like a subscription service rather than just the free live that we do. We love helping, but I mean, we give an hour of our lives to this, but it's actually much more than an hour. I know we're only on with you guys for an hour, but we start at 5, which is 3 hours ahead of the show. And then we continue for the show, and then there's cleanup and prep for the next time. So it's actually like a 4.5 hour thing for us. So we do invest a lot of time and effort into this. And we definitely are not about the money. We're actually probably going to donate some of the money, or much of the money, to a fertility foundation like Fertility Friends Foundation. So we're interested in seeing what your feedback is, and if that's something you'd be interested in, let us know. DM us, or
that would be great. Awesome idea. Very
comment.
Interested. Yes, please.
Oh, really? Okay, there you go. All right, cool.
Very interested. Yeah, having Dr. Victory look over the stuff.
That's cool.
Who doesn't want your undivided attention?
I like that. All right, cool. Sign out.
Sign out.
Have a good night, everybody. We'll see you next week on Fertility Fact or Fiction, where we will be talking about adding progesterone to sperm fluid and getting a near 100% live birth rate. Check us out. We'll see if this works or not. Have a good night, guys. Take care. See you next week on Fertility Fact or Fiction. Thank you to the amazing Tarek Ibrahim, a doctor in his own mind, and not medically licensed in any country that I am aware of.
Not even China.
Not even China, yeah. From Ibrahim Strategies Group. Have a good night, guys. We'll see you again soon. Take care.